Hi, this is Curtis Alexander. I'm a pharmacist. In today's video, I want to cover Sinemet, which is Parkinson's medication, and it causes nausea, which is by far and away its most common side effect. So I'll explain what's going on, and real quick, we'll hop into some things you can do to address the nausea. So first of all, Sinemet is a medication that's composed actually of two separate medications. The first of which is levodopa. Now, the reason we give people with Parkinson's levodopa is because what we're trying to do, levodopa is broken down into dopamine, and we find in Parkinson's folks that their levels of dopamine in their brain aren't as high as we'd like them to be. So the idea is you give them levodopa and the body converts it to dopamine, it gets into the brain, and it helps with the Parkinson's, which is great in theory, but one of the problems we see is levodopa has to get past the blood-brain barrier. And if it doesn't, it gets broken down into dopamine in the periphery of the body. If it gets broken down into dopamine in the periphery of the body, then we get the side effects from dopamine, like the nausea. So ideally, levodopa gets through the blood-brain barrier into the brain, broken down into dopamine, but that isn't what happens a lot of times. So Sinemet, we add in a second medication called carbidopa. And carbidopa's job is basically to block the breakdown of levodopa in the periphery. We want carbidopa to help levodopa get into the brain, increase dopamine levels. So, in essence, carbidopa is there to help prevent some of the nausea that we see. Okay, so I think it's important when we're talking about side effects to understand what's going on with the medications and why you're experiencing the side effects. That's going to help you discussing this with your doctor. So the question becomes, what can we do about the nausea? Well, first and foremost, one of the main things I have people try is what foods are they eating, because what we tend to see is if you're eating fairly high protein at the meals that you take Sinemet at, that can delay the absorption of the Sinemet, and we can see more nausea with that. So sometimes it can help to decrease the protein. It can also help. I actually had, it kind of leads to the second point. I did have a physician who had Parkinson's and he was posting this online, and he goes, the only thing that worked for him was to take Sinemet on an empty stomach. I wouldn't normally recommend that, but it did work for him. So the other options we have, again, decrease protein or space it out. Maybe take the Sinemet 45 minutes to an hour before you eat, 45 minutes to an hour after you eat, or try higher carbohydrate snacks, higher fat snacks. Just try to minimize the protein around the Sinemet dosing. And so again, the low protein snack, we kind of talked about that. The other thing you can do, ginger, peppermint tea, some of those more historical things to help with upset stomach and nausea. Those are some things you can try. The other thing we can try, and this comes back to our earlier discussion, is carbidopa is available by itself as a medication. So you could talk to your doctor, and we've done this before, as you just add more carbidopa in to try to control levodopa being broken down in the periphery, so you get less of that nausea. The problem being with carbidopa, it tends to be pricey by itself. So not always a great option. That's why I listed it last, but it is something to be aware of. And there is one other option. I didn't list it here, but you could add some anti-nausea meds to the protocol. But ideally we don't want to be adding in more medications if we don't have to. So if you have Parkinson's, if you're struggling with the nausea from Sinemet, these are some things you can do. I would also encourage you to go to my website, curtis-alexander.com. I have a free report. I do go over some modalities that I have seen help Parkinson's people. And it's natural. It's not going to cause some of the side effects that we see with the medications. Not saying it's for everybody, but it's something to look into if you're struggling like a lot of people do with Sinemet. So I hope the video was helpful. Any questions, post them in the comments. I look at all the comments. I don't always have time now as I do more videos to answer them. And if you have ideas for other videos you'd like me to cover, please mention them in the comments. So again, I hope the video was helpful, and until the next one, this is Curtis Alexander. Thanks.